Hi everyone, this is Rahul, and my presentation today is about Victor Fuchs and his impact on public health. First, a little background. Victor Fuchs is a professor at Stanford University. He is also a health economist who has become known as the best of his generation by the New York Times. During the 1970s, public health began to gain prominence as an important part of healthcare. During this time period, Victor Fuchs made many important arguments in the field of public health. He argued that the medical care that had contributed to better health in the earlier 20th century would not be effective in the future in reducing mortality nor disease. The reason these arguments were so profound was because during the time a significant amount of resources were being drawn towards medical research in combating specific diseases. Death rates were becoming stable and falling fast, which people thought could be attributed to the advancements in the research. Although these falling rates could be somewhat attributed to medical care, in hindsight it is seen that more important factors including better pollution control and the food stamp program promoting better nutrition in the country, these non-medical related factors is exactly what Victor Fuchs predicted so many years before. These restorative and educational programs seem to have extreme impacts on public health, but were not wanting to be acknowledged by the general public in the past. Based on Fuchs' teaching, Starr writes in his book about two revelations that impacted the healthcare field greatly. The first revelation is that a healthcare crisis existed in the current status quo. Although this seems obvious, it is important to note that to fix a problem must also be identified. Fuchs' teaching pointed out a problem where future healthcare measures may be ineffective and made the public identify the problem and possibly find a solution. Building upon this, Starr coins the second revelation is that healthcare hardly affects health. As previously noted, programs that did not directly relate to medicine had higher impacts in community health as a whole. Perhaps the biggest impact on this mindset shift towards a therapeutic healthcare policy was to concentrate attention on the cost control of medicine. National funding for medical research was extremely expensive, and any way to cut these costs would have been beneficial to the national economy. According to Starr, these two factors are a major reason as to why a national health insurance never materialized in the United States. Victor Fuchs paved the way for how healthcare had developed today. Without his teachings, a problem may not have been identified and money may still have been pumped into the wrong areas, and community health could have spiraled out of control. Fuchs' teachings caused a mindset shift within the healthcare field and caused many public health measures to be instituted in the community, which had a profound impact on public health since the 1970s and are still successful today. This brings me into my question for today. What public health programs that have been implemented have been the most successful in benefiting community health?